So, welcome to the afternoon. I hope you all enjoyed this morning's program. So for this afternoon, we're going to move over to have a talk on integrative medicine, pain management, and medicinal marijuana for cancer patients. We're going to talk about nutrition, psychosocial support, and survivorship. So our first speaker I'd like to introduce to you today is Dr. Michael Cusnir from Mount Sinai. And he's going to talk to you about integrative medicine and pain management. Please come on up, please. What I'd also like to do is, please come on this side. I'm going to see you. So I have to tell you, you know, one of the meetings that we go to every year is ASCO GI. And at ASCO GI, Michael and I met also with Mary Margaret, and they come up with this great idea about having this panel set up. And Dr. Kuznia was so instrumental in helping us to get speakers for this event. So I wanted to present you with a little recognition of the 2018 Symposia committee member in appreciation of your dedication and leadership. Thank you so much. Thank you so much. I appreciate it. Okay, here we go. I'm going to leave that to you. Go ahead. Thank you.
Thank you. Thanks for the recognition. I really think that actually Mary Margaret and Livia did all the leg work, and it was great to just be part of crunching some of the ideas into the symposium of this year. I'm going to be discussing over the next 10 to 15 minutes a little bit of integrative oncology. This is a much lighter topic than what we talked in the morning. This is I'm a medical oncologist, and I also have an interest in integrative medicine. And the reason of why integrative medicine comes into play in integrative oncology is going all the way back to Osler, when he said that the good physician treats the disease, the great physician treats the patient who has the disease. And I think that that's what we all as doctors strive to be, the person that really understands not only just the complex biology of a tumor, but the complex environment of that tumor in the patient that we're treating. And that's not alternative medicine. I have to be very clear. When we talk about integrative medicine, it's not alternative medicine. This is a graph that was tweeted, reported, New York Times report of showing that patients that go on to alternative therapies have a lesser survival than patients that have conventional therapy. And that's no surprise. Science has advanced to the level that we really are getting much better in treating all these difficult illnesses. That doesn't mean that we can take an alternative, and that's where integrative medicine comes into play. When the patients tell me, no, I don't want to do surgery, even though that the tumor looks very early, that's mutilating and all that, and they tell me, I only want to do alternatives, I always tell them, and I took this picture actually local here in the South Florida region of an alternative funeral home. I tell them alternative therapy very likely will get there. We need to talk about integrative medicine. What integrative medicine is really a healing-oriented medicine that takes into account the whole person, body, mind, and spirit, including all aspects of lifestyle. And that's what we're going to be talking. And we use all appropriate therapies, conventional and alternative. So when I'm seeing a patient in integrative medicine consultations, and I wear both hats every now and then, that a patient comes in just interested in the conventional therapies and they don't want to hear about anything else, even though that I always will put up some of the nutrition discussions, some of the different other treatment interventions. But what we do is we really try to use both conventional and alternatives to facilitate the body's innate healing response. And integrative medicine neither rejects conventional medicine or accepts alternative therapies uncritically. We really are trying to strive into, as much as we can, evidence-based medicine. Now, the problem is that when you say, what is those therapies. And this is a list that I actually came up one day on a plane as I was going to give a lecture, and I started putting a lot of different things of common practices that my patients bring to discuss with me in the office, and you can see that the list could be even never-ending. We always tend to summarize it into nutrition, mind and body practices, manipulation practices, spirituality, energy, and whole body system practices. I'm going to try to talk very little on all that. That into the patient's terms. When we're talking about what does the patient has in his power and in his realm to be talking about this type of things, it really means that I'm asking for my patients to control weight, healthy eating, appropriate use of supplements, regular levels of physical activity, breathing and stress reduction, guided imagery and self-hypnosis, something that is quite cheap and quite common to use, and connect with family and friends and engage in spirituality and religion. Now, you see that I make a difference in between the two of them. And some patients are religious, some patients are just spiritual. Some patients may just tell me, and we'd have these discussions in the office when I ask them, what is your spirituality level? And that's almost the discussion of what do you live for? And it could be as simple as I live for my kids, or I live for future generations to see me do the different work that I do. So some people may be spiritual even about their job. That doesn't mean that they're religious about their job. Talking very shortly, with the constraint of time, we have even done seminars of this type of topics that could go over the whole day, but mind and body medicine is defined by the National Complementary and Alternative Medicine Institute from the Institute of Health as a practice that focuses on the interaction of the brain, mind, and body and behavior with the intent to use your mind to affect your physical functioning and affect and promote health. Sounds like a complex thing, but they could be of many techniques. They could be hypnosis, guided imagery that has been used even to decrease stress prior to surgery, kind of like aiding your body to prepare for surgery, even using yoga to improve the level of sleep, mood, and creative therapies. I have a lot of patients. I'm currently treating a person that is an artist, and I keep telling her, put your art into work. Go with your art and start to see if your art can aid and do even journaling with your art of how are you treating your cancer. And it's been helping dramatically. And there's several studies showing that mindfulness-based stress reduction can improve the psychological well-being and the quality of life, not only of the patients, but even of the caregivers. We were just talking a second ago that survivors are not only the patients. Survivors are all of us that interact with the patients. So all these techniques are going to be important. I'm going to be, again, touching topics here and there. I don't have the time to go deep into any of the topics, but if you talk about some other things like medicinal mushrooms that we use quite frequently in some of our diet, I'm not even talking about taking a pill. We're talking about cooking with medicinal mushrooms and using them. They may have some benefits, and there's some studies, early studies, basic science studies, that they may even have some immune enhancement, even on the patients that have some different cancers. There's better studies. A lot of the data of integrative medicine comes from breast cancer, just because they are the ones that are doing a lot of the studies and volume of patients that they have. But you could see that even in gastrointestinal malignancies, Trametes versicolor, which is a type of medicinal mushroom that could be used in many ways, has some early preliminary data that it's interesting. Similar things happen with some Chinese medicines and Chinese herbs like huan qi, that is also named botanically here in the Western Hemisphere astragalus. There's studies and meta-analysis and a lot of these scientific curves that when you combine huan qi with certain platinum-based chemotherapies, the benefit is seen, and this is coming from big data sets and a lot of studies. I won't bore you with the graphs, but they actually show significance. So we don't have to be, I would say, to cover the sun with our eyes, that there's some data of a lot of these different things. Similar things happen with ginseng. And again, you could either cook or take it, but fatigue scores. that are common complaints of our patients. When the patients tell me, perfect, I'm tolerating the chemo, I'm not getting any side effects such as fever and a lot of the different things that you told me that I was going to experience with chemo, but I just feel exhausted. Is there something I can do to bring up my level of energy? I could definitely give the patient drugs like methamphetamines with all the side effects that they can carry, even with the risk even of having methamphetamines at a home with young kids, pets, other family members, or I might be able to tell the patient, why don't you boost up on your daily routine using a little bit of ginseng that has been shown in short-term inventories of fatigue to improve the quality of life of these patients. Now again, there's several types of ginsengs. I do think that these require a little bit of basic knowledge of botanical medicine. We're talking here of American ginseng, not Siberian ginseng or Korean ginseng. So all the different graphs have shown improvement, yet when you see in the regular medical practices, if this is being done, it's not common, and it does require that you talk to your doctor and ask him, and if he doesn't feel comfortable in using some of these, referral to a center that has integrative medicine services would be important. I just put the slides as demonstration that the studies have been done and that are a lot of different things that we can do. Now, what's the problem with a lot of the botanical research and the criticism that we have as scientists when we're looking at this? There's very little standardization. A ginseng that you may get at a supermarket versus an online store versus prepared at home may not be the same one that was done in the clinical studies. And the same, and what I just told you of ginseng, Korean ginseng versus American ginseng are completely different plants. Nothing to do one with the other one, with no benefit of one over fatigue, over placebo, and the other one being very effective. The part of the plant being used is important. When I'm teaching integrative medicine to my residents, that we have a grant to expose our internal medicine residents to 200 hours of integrative medicine during their residency in internal medicine, I tell them the part of the plant that you use, it's important. If I tell you I would like to prepare wine, either from the grapes, the leaves, or the root of the vine that it's giving the same type of fruit, everybody will say, like, you cannot make wine out of leaves. Well, you probably can, but I don't think that it will be very tasty. That's important. The same goes with botanical research, the type of extract. If you're going to make it from alcohol, if you're going to make it from butane, the concentrations, the doses, it's just very difficult even to control the placebo group. If I tell somebody, I'm going to give you either a placebo or ginseng to control fatigue, the patient is going to go to Whole Foods and buy ginseng because he's like, no way I'm going to take the placebo. Let's talk quickly about pain, and as part of pain, I'll segue into what we call whole systems or whole body systems. That includes the part of the traditional Chinese medicine, like acupuncture, and this is kind of like some studies of numerical score rating of pain over time. So, two things to look when you're looking at studies with integrative medicine. They may not be as fast as taking a narcotic. Yes, the rapid side effect of a narcotic, such as morphine, will be much fast, but if I can use acupuncture and decrease at a 5 to 6 week level the amount of narcotics that patient used by continuing to use some of these techniques, it still would be beneficial. So we need to combine them. There's a lot of different clinical trials, even with acupuncture in this setting, and overall, I don't know if this reads well from a distance, but what we're looking here is really at the chronic pain use. I'm not saying that a lot of these integrative medicines will help for the acute setting, immediate pain, postoperative pain, even though that there are some studies, but on the chronic base, and even when we talk about cannabis and marijuana, the interaction in between the opioid receptors in the brain of some of these botanicals and some of these other manipulation techniques, such as acupuncture, will help on the long run to use much less narcotics, which definitely would be beneficial. And why? Because we're going to be dealing with less amount of constipation, the mental sundowning of the patients as they are taking all of these narcotics, confusion, possibility of driving. As simple as that, of the patient saying, can I drive when I take these doses of morphine? And I say, probably you shouldn't, versus, can I drive with an acupuncture needle after I leave the acupuncturist office? Yes, you absolutely can, okay? And that could be done even with some techniques as electroacupuncture, that you can see that during the day they might help, and some patients could be taught how to apply to certain meridians the electroacupuncture by their practitioners. Overall, there's also meta-analysis, a lot of scientific data that it's not well powered. We still are learning. We need to control these groups better. We need to figure out how to do it, and even the practitioners that are experiencing. But things as simple that a lot of times when we talk about spiritual practices and when people say, like, does it make any difference? To even just be hopeful that things will be better. And you can see that there's, even on patients that are undergoing major surgeries, like the ones that are done for gastric cancer, the specific complications were significantly more likely to occur for the patients that were not getting what is called surrogate praying. So when the patients tell you, in my church there's a lot of people praying for me, and we may just say as doctors, like, yeah, whatever, well, maybe not just that much at whatever. And what harm does it make for the patient to have a support group like that one? Very little. Again, can I do a clinical study? Can I prove that people that are getting praying groups and things like that for them works? Well, I don't know, because maybe does it work only if we pray in really holy places like the Wailing Wall? Does it matter if it's the pet that is praying for his owner to just come back and feed him again the treats that he likes? Or does it matter on the number of people that pray in all those chain different type of things that we get on our emails? So all of them matter, and I cannot do a scientific study about them, but I should not tell them that not to use them. What's the bottom line of all that we're talking of integrative medicine? You still need to be aware that there's a potential for drug complementary alternative medicine interactions. There's no alternative. There's certain things that our patients are doing, and we actually should probably encourage them to just discuss them with us so that we can do them in a better judgmental way, and in a way that we really could guide them and tell them what to do. There's a lot to be done for prevention and even supportive care. And later on, as we get into the topics of survivorship, 65% of the people that are diagnosed today with cancer may be cured. And that 11.7 million cancer survivors are going to be important to be looked at that. What I tell always my scientific colleagues when they tell me, I remember when I started studying integrative medicine in 2010, that I did my fellowship at the University of Arizona, and they told me, like, what, are we going to get the office now with a lot of crazy people asking for crazy things? I always tell them that even in a day when evidence-based medicine is the rule of the land, the absence of evidence is not the evidence of absence. And that the safety of the treatment is what it should push for the evidence needed to accept the intervention. If I'm going to give somebody something as little toxicity as it may sound of immunotherapy, but that we still see toxicity, even that it could be of lethal colitis, I need a level of evidence of very high level, because I'm putting patients at risk. But if I'm going to tell the patient, just hope you're going to get better, I don't need that high level of evidence. So my level of evidence needs to be taken into consideration when I propose these type of things. And I always tell the patients that Maimonides, that was an old philosopher and physician from the Middle Ages, used to say that everybody has a doctor within himself. And with that, I tell always the patients that they have a healing presence and that they could just take it as simple as breathing in, breathing out all that they have and holding. Again, breathe in and out and let go. Allow the body to relax, harness the energy, and bring up that healing presence, and be more aware even of their own breathing as they walked into their treatments, their office, and we as physicians, as healers, into the patient's room. And that I also teach my residents every day as they go into every patient room. And with that, I'll be more than glad to take questions after the second panelist. Thank you.